In this video, I want to give a bit of inspiration on how you can treat the large intestine meridian using Shiatsu techniques. And this video is for people who already know how to locate the meridian and when to treat it. So see it as a sort of enrichment for your practice. Maybe it gives you more ideas on how to mobilize the joints, how to activate the meridian and moving the chi, essentially. Okay, large intestine. So young meridian, we're on the young side of the arm. And what you can do starting with the arm is simply that you have the arm lying in an angle about 30 to 45 degrees. It kind of changes per person. And you roll it around so the palms lay flat on the ground. And if you sit here next to the arm, on the outside of the arm, all you have to do is simply give perpendicular pressure. So really the position of the arm and your sitting position determines if you reach the meridian exactly or not. You can imagine there's many meridians on the arm. So remember the position of the arm and your sitting position. And your mother hand really rests on the shoulder head. So the large intestine meridian is kind of moving over the head of the shoulder and going to the neck, the arm. So this is just to test what is the condition of the meridian. Feels a bit Jitsu, so we can apply a couple of Jitsu techniques. So what we can do to start off with is massaging the hand, just to get a feel how much tightness is there in the wrist, but also in the joints of the index finger, which is the end of the large intestine meridian. So what I do is that I pull and push with the thumb, pull with my index finger to give space to the knuckles. And then you can also rotate the index finger to get an idea of the general condition of the meridian, because the index finger is kind of representative of the large intestine meridian. And then the two wonderful points to activate the whole meridian is large intestine 4, as most of you might know, and large intestine, what is it, 11. So in the elbow crease, at the end of the elbow crease, sort of here, it's actually wise to learn how to really hit the spot, and if not, you can always check with your clients. So, Malu, do you feel this one?
Mm-hmm.
It's not a really nice sensation per se, it can be really intense. And these 2 points are great to release heat from the body. But they also activate the meridian, so it's a nice way to start. Rotating the elbow and alternating the pressure between both points. And then you follow the meridian, giving deep pressure with your thumb, often like very tense muscles in the lower arm. So if you feel, if this is very Jitsu, you can also like rest both hands on the meridian and use the knee. Make sure not to break the arm of your receiver. And you just slide it down the first half of the lower arm. Wow. The upper arm, you can just hold hands and again give it a nice squeeze along the meridian. If it's Jitsu, if it's Kyo, you just use the palm of your hand and you work a little bit slower. the arm. Now moving to the leg, which is actually working on the Masunaga Zenshiatsu extension. And I'm so glad that someone mapped this extension, because oftentimes it really helps in effective treatment, especially for the hips, but also for the large intestines itself. So what we can do is figure out in the first place if there's tightness along the meridians, and we have different stretches. There will be bladder, for instance, and the direction towards the shoulder on the other side. If there's tightness here, you already know, like, aha, gives me an indication to treat the large intestine meridian. This would be gallbladder, large intestine. It kind of feels like it could need a little bit of treatment. So what we can do is apply the stretch and work with the thumb. But if it's Jitsu, what I always do is I rest the leg, fix it with my knee, so the foot rests just on top of her knee. Fix the hip so the leg doesn't jump away. And now I can just work with my lower arm, going in there, reaching the meridian, and then giving it a little bit of direction, not working too quick. This will be the upper leg. And afterwards, what we can do is rotate the leg and work with the knee just behind the head of the femur. It can be very sensitive and it's great for relieving the large intestines and stiffness in the hips. So you just wait until something happens. You could also rest one of your hands on the meridian to feel better. My actual preference for treating the extension in the legs is in this position, because I can also work more effectively on the lower leg, but also on the hip in a really dynamic way. So this is combining not only Shiatsu techniques, but also Thai massage. So we can rotate the leg from the inside to the outside. What is it? Clockwise. And then you just locate the head of the femur, and you feel the edge of the head, connective tissue around it, and you don't really have to do much. Actually, the massage comes through the rotation, gives a nice movement, also relaxing for the knee, relieving chi in the knee joint. And then to treat the meridian, you kind of lay the foot, you hook it behind the heel of the other foot. It's not always possible. Sometimes you just have to hold it with your other hand. And then you can work with the palm of your hand, you can work with the thumb. But at feeling Jitsu, I like to work with my lower arm. And again, like going deep and then giving a little bit of direction and movement. Can be very sensitive, so don't work too quick. This is one way. Now you could do the same with your other arm, maintaining the connection with the upper leg. And oftentimes both parts, upper and lower leg, are quite sensitive. And oftentimes you will feel that right next to it there's the kidney meridian, so it's getting really soft, and it's a transition from the soft part do the hard part. If you don't know exactly where, it doesn't matter too much. Just sit like I do, cross the leg, and you will just fall onto the meridian. What you can also do is rest your upper hand on a diagnostic area of the back. So this is diagnostic area, large intestine. And you work, for instance, with one knee. But you can also just give a short pressure with both knees. Is that okay? Mm-hmm. Can it go deeper? Yes. And really check with your client, where's the edge? Just be not over the edge, but just hitting the edge. And by connecting both points in the knee, actually you're also treating the hip. So my teacher used to say you don't have to treat the hip anymore if you put both knees on the meridian. It's just a short, intense, and effective way to activate the meridian. And the extension actually ends at the base of the toes, just in the middle of the foot. So you can also decide to treat this as well. Now, large intestine, you can also treat via the back shoe points. So the back shoe points of the large intestine are just in front of the sacrum. So it's really the end of the letter meridian, just before the sacrum starts. And you want to give perpendicular pressure. So you could do that like this. But it doesn't feel that nice to me. So what I do is that I work from above the head and give perpendicular pressure like this. I can use my hara much more effectively. What you can also do is give a little bit of motion dynamic over the whole diagnostic area of the large intestine. What you can also do, since we are already in lying position, is to treat the arms like this with one simple technique. And that is, I'm gonna show first. So what you're doing is that you slide the arm forward and you stretch the wrist. And when the wrist is stretched, you push the hand into the ground, and with this hand, from your hara, give a stretch on the upper arm, which actually is giving space to the top of the shoulder and the wrist at the same time. And you can repeat these a couple of times. And you can also repeat it by hooking the finger behind large intestine 11. Makes it a little bit more pointy, depending on the condition. For instance, imagine you're treating an elbow condition. You could give a bit more accent on the elbow. So, as I told you, the meridian is crossing the head of the shoulder and crossing it in the front. So we can just generally check the condition of the shoulder like this. Will give us information on many meridians actually. And the way to sit is, okay, I could sit just in the sisa, but I could also sit in, I think it's called monkey position in Thai massage. And once you figure out which meridian to treat, in this case large intestine, you have a couple of options. For instance, you could give a stretch in this direction. Actually, this pillow is quite high. If we take it away and we give the stretch in this direction, what we do is stretching the large intestine in the neck. So pull from your hara until you feel the creation of space. A little bit. You can also work nicely on the upper arm by just letting the arm rest behind your body. Connect your mother hand behind the shoulder blade, and then you could work with the thumb, although it's quite hard to work from a hara like this. So what I do is work with my lower arm. Especially the top of the upper arm. It's really nice to treat in this position. Kind of my favorite position for treating this area, at least. What we can do is also give a little stretch, again with an accent on large intestine 11. That's one way. We can also rest the arm like this and treat large intestine and small intestine at the same time by squeezing the upper arm. And depending on what you find, you can give the accent more to the large intestine or to the small intestine. Large intestine being in the front. And ending with a finger. Just generally checking the condition of the finger. It will give you an idea of how effectively you treated the arm. Now the neck. It's actually a kind of a strange meridian because it's just crossing the leg. It's not really like moving alongside the larger muscles. So what I do is I pull the shoulder and I give Shiatsu pressure at the same time. And without knowing exactly where the meridian is, I think it's also a good idea to check out where's the tension in the neck and just follow the tension. So it's also a little bit of searching, but if you have a large intestine condition, you will find the tension in the neck. Just follow it down. Now I'm sitting in monkey position, but I could also do the same thing in Saisa. And now we would really work in front of the trapezius muscle. So normally with gallbladder and triple heater, we would use this amazing technique, which generally is a nice one to use in your session. But for large intestine, I'd rather work with my thumb in the front. Until you reach the shoulder bone. And again, you give a little stretch with the mother hand while applying Shiatsu with the other hand. This is large intestine and side position. Now there's also a whole diagnostic map on the belly with the diagnostic areas of the large intestine being located just in front of the hip, and that's actually where the large intestine, so if you imagine the organ, it's making a round, right? Underneath the liver, the gallbladder, underneath the diaphragm, the stomach, pancreas, making a round, and here it's making a sort of turn upward towards the navel, and in this location, this is one diagnostic zone of the large intestine. So if this is tender or it's really a spiky pain sensation on pressure, so you could, for instance, check with the side of your hand. Large intestine has something to say, apparently. And the other side as well. You could also check like this. But being aware that the movement direction of the large intestine is like that. So it goes clockwise, first reaching the liver, then the earth organs. And that's important if we want to treat the large intestine directly. So we could use, for example, Shiatsu techniques to work on the large intestine. But knowing the location of the large intestine is already enough to give us an idea on how to work it. So, for instance, how I would do it is, okay, if you have the navel here, next to the navel is stomach 25, and that's the alarm point of the large intestine. So if that point is very sensitive or tender, it gives you information on the condition of the large intestine. So be careful and check with your client how that point feels. It's good to know like how tender it is, because you want to keep your client here and not running away inside because it's too painful. So it's good working when you work on the organs directly to really check in with what is possible, and your client will have to do a lot of work there, being with potential pain, releasing. This is really a collaboration, but the technique would be as follows. So knowing that the meridian ends here, we kind of want to loosen it up counterclockwise, so against the direction first. Kind of, if you imagine this being a traffic jam, you start at the end of the traffic jam, so the key can move the way it should. So you can do some general work first, making contact with the belly. And kind of a wavy motion. You kind of take the large intestine and you push it back on the other side. And you can explore a little bit the different corners of the large intestine, preparing it for the deeper work. And then you would want to like create distance between the large intestine and the hip. So you could like hook your fingers and work from the hara, pulling it away. And you can do it in this way. Working upward. Towards the ribs until you feel like the creation of space. You could also do it by giving a little bit of space to the organ, resting the upper leg on your leg, and then working with the side of your hand. make sure you give pressure on the exhalation of your client. And again, this can be really tender, so work verbally with your client, but really pay attention to the exhalation, because large intestine is about letting go, release, and the exhalation really plays a major role in that. So work on this area. Now, next to the diaphragm, we could apply a wave with your hands like this. You could also pull down and really giving the organ time to respond. And the wave kind of imitates a peristaltic movement of the large intestine. And then we would work our way to the end, actually the connection between large intestine and small intestine, the gate of Bohan. It's kind of a busy area here, liver, gallbladder, large intestine, so make sure you work on the large intestine. You can rest the mother hand on the sternum. You can also work with two thumbs on top of each other. You try to hook behind the large intestine from the outside. And once you hook it, you give it a gentle push upwards, kind of trying to create space underneath. And again, can be very intense. And if you feel like there's tension in the first bit of the large intestine meridian, what you can do again is give space like that between hip and large intestine. And rounding off with a circling motion. And resting your hands either above and below the navel, connecting two sides of the large intestine, but actually I prefer connecting the sides left and right, just feeling in. And oftentimes the large intestine starts to let go now, so it's not necessarily the intense part of the work that does the job. Sometimes just resting. So that would be it, large intestine. Thanks. So this video on the large intestine meridian is actually the first one of a series of videos in which I will explain how to treat each of the 12 basic meridians using Shiatsu techniques. So if you want to stay updated and see the rest of the videos, you may want to subscribe to the channel. It's been a pleasure. Mwah.